Hello, thanks for taking a few minutes to learn about our sublingual form of semaglutide. At Norland Avenue Pharmacy, we offer sublingual semaglutide at 12 milligrams per ml that's in a submagna high molecular weight base. That's perfect for holding the semaglutide and helping it get absorbed sublingually. This formulation is designed to give practitioners flexibility in dosing while maintaining cost effectiveness and giving us individual titration for our patients. We recently changed the concentration from 4 milligrams per ml to 12 milligrams per ml. This is allowing for higher dosing and it's becoming much more cost effective. In fact, it's a savings of 58% for the patient. For new patients, we typically start them at 0.3 mLs, which would be 4 milligrams, and have them increase weekly by 0.01 ml. We want the patient to hold the solution under their tongue for approximately 5 minutes, if not longer. That will allow increased absorption sublingually and will help improve the efficacy of the medication. If a patient is transitioning from the 1.7 milligram injection, we typically start them at 0.4 mLs, which is 4.8 milligrams each day. If they started at the 2.4 milligram injection, we want to start them at 0.5 mLs, which would be 6 milligrams per day. Maintenance dosing is individualized, but after being on a stable dose for 1 month, they can then increase it by 0.1 mLs again. In our experience, optimal therapy is achieved 2 to 3 months into utilizing the medication. The medication will not work effectively if directions are not followed. We do need the patient to try their best at holding the medication under their tongue for 5 minutes. And they should not have eaten anything for an hour prior to dosing and for at least 30 minutes after dosing the medication. After holding the suspension under their tongue, they should swallow it. The medication is a suspension, so it does need to be shaken each time and should be kept in the refrigerator in between dosing. For optimal results, we do recommend individual titration, adequate protein intake and hydration, as well as movement throughout the day, some regular exercise. We would also recommend evaluating and optimizing hormones to get the most out of the medication. Our compounding care specialist will contact our patients after they've received their medication to ensure they understand the directions and are getting optimal therapy. They're there to answer all the questions, and we want to see them take the medication appropriately and on a regular basis to get the results that they want. If you have questions about dosing conversions, who the medication might be the most appropriate for, or anything when it comes to compounding, please don't hesitate to call us at 717-217-6790. We are the area's only PCAB accredited facility, and we would feel privileged to work with you to take care of your metabolic patients.